RDH Podcast. I'm Katie and I'm your host. And today we're going to be talking about informed consent and how it's related to ethics and things that we as hygienists should be thinking about and engaging with patients every time we enter into a contract. And I promise that not all of these episodes are going to be about ethics, but I do have an ethics workshop coming up. So it's kind of hot on my mind right now. So I thought that it would be nice to sort of talk a little bit about how our um, everyday practice is really impacted by a lot of the ethical principles that we talk about in the workshop and why it's really important to kind of keep it on the very forefront of your ideas. So today we're going to be talking about informed consent specifically and some of the major issues we can run into. And we are also going to be obviously talking about autonomy. So autonomy, going back to like ethics 101 from dental hygiene school, autonomy is the ethical principle that really directs informed consent. And that's why informed consent is really big part of the legal aspect of our care, because we want to make sure that the patient still maintains their autonomy. And so we're going to today talk a little bit about what informed consent is and what needs to be there in order for informed consent to be valid. And we're going to talk about what are some of the things that invalidate our informed consent. And I want to preface this talk by putting a little disclaimer out there. I am not a lawyer, and none of this is legal or medical advice. I'm just talking about some of the things that we can do to help our daily practice and what that might look like for you. I'm 100% sure that you have run into some of these issues, and every time we run into it, it sort of teaches us how to maybe approach it a little bit differently in the future. And so hopefully you can kind of take away from this some ideas about how to really get concrete about how you're obtaining informed consent. So we're going to start the talk by the things that we need for a valid informed consent. What are the things that we need? The first thing that we need for informed consent is we need to make sure that the patient has capacity. And capacity is really the ability to make their own decisions. And the first part of capacity is for them to be able to understand and recall the information back to us. That's why it's really important to have strong patient communication techniques. And that is a workshop that we're going to be doing in the future, is patient communication um, skills. And I think it's just, it's not something that we just have within us. We grow and learn and adjust based on how each individual patient works with us. That's part of relationship building. That's why it's so important to have a beat on how we build relationships. But understanding capacity is really, really important to reduce your legal risk for anything informed consent related. So capacity, the first thing is they have to have the ability to understand and recall the information. So there's ways we can do that, right? We can talk to our patients, we can have conversations, we can have them repeat back to us what they're consenting to. That's really important. And part of this can become an issue, and there is legal precedent. Again, I'm not a lawyer, but there is legal precedent to show that dental anxiety can actually reduce a patient's capacity. So dental phobia, dental anxiety, all of that really impacts a patient's ability to obtain new information. If we think about some of our reactions to information presented to us when we're in a state of anxiety, if you even just think about like trauma-informed care, we've been hearing that a lot lately. A lot of people's responses to what a perceived threat may be is fight, flight, freeze, or fawn, right? And if the patient is in that state, their ability to understand the information that we're giving them is diminished. It's not as strong. So we have to be able to read them and in order to read them, we have to sort of have even the smallest little bit of relationship with them. So that way we're able to determine if they are in a state of that fight, flight, fawn, or freeze. The consent also needs to be voluntary. And that sounds pretty self explanatory, right? Yes, we are not, putting this patient under pressure to do this. But when it comes to some of that legal jargon, coercion is not voluntary, right? So if we're trying to coerce or deceive, deception is also a big piece of this. Um, that consent then would be invalidated. And to follow up from the conversation that we had last week about coronal scaling, the for example, a hygiene or a assistant who's doing a coronal scaling prophy, which we talked about right now is not legal. If they were getting the supra scaling and the polishing done by an assistant, and you entered in a contract with them for a prophy, which includes some gingival cleaning, um, that's a piece of deception, right? So that patient is being deceived about what is being done. So at the point where they're not understanding that an assistant is doing the cleaning, not a hygienist, so the cleaning is only supragingival, that would be deception, and that consent would not be considered voluntary. We also need the consent to be based on sufficient knowledge in order for the patient to make an intelligent decision. And that's our job, right? That's where we come in. We have to be able to educate our patient about what the procedure is. So when I'm working with students and we're in perio class and we're talking about informed consent for periodontal procedures, there are pieces of that informed consent that are really important. And those pieces include the option to refuse. And with that option to refuse, what are the risks and benefits of refusing? And the option of what we're performing, what we're offering. If it's, for example, a periodontal patient and we want to do the procedure of scaling and root planing, we need to discuss what that procedure is, what are the risks, what are the benefits. And I think it's really important to talk about risks, especially as in post-op pain. There is nothing worse than having unmet expectations when we talk to the students about, maybe some bad patient interactions and how that happens. A lot of the times, the examples we use are actual real life examples. And most of the examples are of patients that just had no idea what the post-op pain was going to be like. And when they are expecting that, it's typically perceived to be less severe or less of a big deal. When patients have an expectation, or I guess I should say a lack of expectation of what to expect at the end. So in the morning after SRP, they wake up, their gums feel swollen, they feel sore. I've had a patient tell me it was like being punched in the jaw, and they are not expecting that. That's where we have a lot of communication breakdown and mistrust. And so, really big, important piece to protect you on the backside of informed consent is telling them everything about what could happen. Now, does that mean they're going to wake up with pain? No. But we've set the expectation that that could happen so that in the case that it does happen, they are aware and they're planning for it, and um, they're going to have a big idea of what that might look like or feel like. The last piece of a valid informed consent is the consent by either a legal guardian or a power of attorney. So if you have a patient that does not have capacity legally and they have a legal guardian or a power of attorney, then it's really important to include that person. Otherwise, the consent, again, is not valid. If there are minor, they would have a legal guardian or a parent. And if there was some other sort of capacity issue, like um, a diminished capacity from cognitive decline. I'm thinking maybe of a geriatric patient who might have some dementia diagnosis. For any purpose, and that was just one example, but there's tons of other examples that we could use that the patient does not have legal capacity. In that case, we need to make sure that the legal guardian and the power of attorney and or the power of attorney are included in those conversations. So that's really important. And all of those four pieces. So we talked about four. We talked about capacity. We talked about having the consent be voluntary. We talked about consent being based on sufficient knowledge and evidence, and we talked about the consent being with a legal guardian or a power of attorney if required. And so all of those things would help you obtain a valid informed consent. So now we're going to just switch that. We sort of talked about the other hand of this, but then to summarize or to sort of turn the other hand, we're going to talk about invalid consent. And so invalid consent would be invalid if it's gained by fraud. So again, we talked about being misrepresented. If we're misrepresenting what we're doing, if we're doing a prophylaxis by an assistant that's not going sub, if you're not going sub for your pro fees, that's fraud. We're not doing the procedure that we're saying that we're doing. You're breaking contract because you are not completing the full procedure. So if the assistant is doing that and not going sub, that would be supragingival scaling. That would not meet the criteria to be a prophylaxis. So that would be invalid. The patient didn't consent to that when you said that they were doing a prophy. They consented to what a prophy is, and a prophy is going subgingival. Another thing that would invalidate informed consent, which we sort of also talked about, is it with the capacity piece, is the patient not being lucid. And so they are in pain anxiety. We talked about that, but it also could be under the influence. Some patients, medical marijuana is legal here in South Dakota. And so some patients, if they're managing some sort of pain or anxiety with a drug, and this could be a legal drug or medical marijuana, or it could be alcohol, it could be something, that we don't even know about, but it's our responsibility to make sure that the patient is lucid and able to consent. Now, do we 100% know that they're lucid? No. I remember when I was a student back in 2000, it had to have been 2000. I graduated in 2009, so it was 08 or 09. But we had a patient come in to one of our rotation sites, and he was clearly, both by smell, I could smell it on him. And I could just tell by the way he was acting, he was under the influence of both marijuana and alcohol. And it was a very kind of memorable learning experience because I was a student and I was nervous and I didn't really know how to respond. And my instructor was amazing. They helped us dismiss him and make sure he was safe and made sure I was feeling okay about it, I guess. But I think that it's important for us to be able to have hard conversations with our patient. If they're not able to consent because they are under the influence of something, then they need to know that. And some sort of process or follow up should happen in a time when they're in a more lucid state. So, another thing that would invalidate informed consent is if the treatment is illegal, right? So a patient can't consent to something that is illegal, either because one, they don't know it's illegal, or two, because again, it's being misrepresented. Perfect example, since we're continuing to talk about coronal scaling, if the assistant is doing the prophylaxis and going sub, so the patient consented to the prophylaxis, the assistant who's allowed to do coronal scaling, but only supragingivally, but instead they go sub just to complete the procedure and get it done, that would be considered illegal. So at that time, the consent is invalidated because it's not legal in our state, I know, and many other states for them to do that. Uh, in terms of the legal guardian or the power of attorney, if you're working with maybe a social worker or somebody that knows specifically or has the legal documentation that they're the appropriate person to do that. Obviously, if it's a parent, we don't need like legal proof, but it could be a situation where maybe it's a step parent and that the other parent, the legal parent, couldn't be there, and so maybe a step parent came and they weren't allowed to make a decision on behalf of that child that isn't really legally their child. And so it's important to have those conversations too. I know some of those topics are a little bit controversial and you don't want to step on toes, but yet we need to make sure that that particular parent or step parent or caregiver, maybe it's a situation I know in our town, where our school is, we have some patients that are part of a group home. They're adults, but they may have a social worker or a care worker come with them, making sure that that person, the caregiver, a lot of the times is not the legal guardian. It might be a family member, and usually the caretaker knows that and has the paperwork from the family member or something. But we do need to just make sure that we are obtaining the legal documentation for anything that we're not sure about, or just asking the question before we proceed. We also want to make sure that the decision, let's use a child, for example. We want to make the decision that is in the child's best interest. And I know that we use, as an example, a lot of the times in our ethics class, the the parent that maybe just wants the tooth pulled instead of getting a pulpotomy or something like that. And maybe it's a financial decision. Maybe it's just a decision the parent's making because they don't understand the importance of maintaining the space for the adult dentition to come in. And so, if that's the case, and we're a little bit concerned, and there are some very severe cases that I've seen and worked with that the decision is not in the best interest, that goes all the way to social services. And again, that's a little bit of a hard conversation to have, but same thing with neglect. Neglect cases are like that, but also sometimes they do procedures more aggressively because they don't want to maybe pay a little bit more money, or under maybe they don't even understand the importance of that. So I think, again, having some of those harder conversations about really this is not in the best interest of the child dentally. Maybe if it is a financial thing, maybe there's some things that we can work around, but I've seen just personally in my practice cases that do get very severe, in which social services was contacted saying that, this is what we've said, that this is not in the best interest, and we're concerned that the decision isn't being made for the best interest of the person that can't obtain consent, right? These patients, these children, or these patients with power of attorneys, maybe it's not in their best interest. And we just need to make sure that we're making, or we're helping make the best decisions for the family. So those are the basics of informed consent. This one was a little bit shorter today and it's a little more basic, but I think it's always good to review the basics, because I think a lot of the times when we just get so in the grind of day to day, we don't always think about going back to the basics and making sure that, that patient is lucid. We have enough ability or enough relationship to be able to determine if that patient has capacity or not. I think capacity in dentistry can be um, very broad, in that we know that some patients really struggle with health literacy. We know some patients struggle with dental literacy. And that's our job, to build those relationships and help the patients make the best decisions. Do they have, as much knowledge and information as we do? Probably not. But it is our responsibility to be able to educate them in a way that makes sense for them and to build that relationship with them. That way we can decide if they have capacity or not. And building relationships really is the best way to do that. It's the best way to um, help the patient become or play a bigger role in their own self-directed care, right? So that is it for today. Thank you for listening, and I appreciate you joining in the community. So if you have any cases or you have any situations where you maybe wanted some insight on how to best attack this issue or things that you've found that work, please comment and let us know and help us help each other decide how to get informed consent the best. I appreciate it. Make sure you like and subscribe, and I'll catch you on the next one.